day is today? June 10th, Board of Douglas County Commissioners, 4 p.m. work session. Reminder for anybody who's with us in person, who's online or watches later, work sessions are for informational purposes only. It's an opportunity for us to dive into a topic, receive information, have commissioners ask questions, and have discussion amongst ourselves. But as always, we have a business meeting to follow that will start at 5:30 p.m. And there's always general public comment available during that agenda. So if you have any thoughts you'd like to share with us later, please do, and you can contact us in writing. And with that, I believe I'm just turning it right over to Jill Jolliker this afternoon.
Yep. Thanks, commissioners. While I'm getting the PowerPoint teed up, we'll come back to me and I'll start off the presentation. But before we do that, I want to make sure we go down around the table and provide introductions for all of our guests, our partners on this project. So I'll start with Zach and we'll work our way down. If you grab the mic and...
Hey y'all, my name is Zach and I work at the Sexual Trauma and Abuse Care Center.
Benicia, Family Promise of Lawrence.
My name is Carrie Nice. I am the reentry director out at the jail.
Kim Freeze. I'm the DECA Behavioral Health Chief.
I'm Sarah Knopf-Amelang and I'm with Amethyst Place.
Hannah Bolton with Cardinal Housing Network.
I know we have some other partners in the room as well. I want to make sure I call out Hattie Moore with Cardinal Housing is here, and Christina Holt with the KU Center for Health, Community Health and Development has been a part of the project. And then we have Christina Gentry with STA Care Center as well that have been a part of this project. So we have a robust partnership. You'll hear more about that in the network that we're going to present with you to you all today. But we're here today to present to talk about the supportive housing for women in Douglas County and a network approach to maximizing resources and coordinating care. This work comes out of the impetus for this project is a place for everyone. Our strategic plan to end chronic homelessness in Douglas County. Commissioners recall that that the disparities that existed for women in Douglas County experiencing homelessness are higher than the national and the state rates. So in an effort to understand why that experience occurs, we've delved into several conversations and that have been ongoing. When you look at the sexual violence prevention work group that has been underway for several years under the leadership of Live Well and the STA Care Center, but also looked at partners like the Douglas County Reentry Department, who has been working with this population for several years, and we have other partners. But we also decided that we wanted, as we embarked on this path, we wanted to learn from an established leader. So we partnered with Amethyst Place, that's based in Kansas City. And I'm not going to read through all these slide presentations, and neither are word for word on all these partners, neither of the partners on here, because we want to make sure that we have plenty of time for a discussion with you all. But and you had all these materials in the packet. But we partnered with Amethyst Place. We talked a little bit about Amethyst Place work when we were earlier this year when we were talking about the municipalities fights addiction funding and why we were seeking their assistance. Their record really stands out, and you've got some of the outcomes there. And I know if you're curious to take a deeper dive, if you want to ever see the work in progress that happens at Amethyst Place, I know that Sarah would be happy to organize a tour. Our work team's been there, and so yeah, we assembled our core network of service providers, and you've already heard from several of them around the table. And then what we did is we conducted a SWOT analysis that you have copies of, everyone has copies of, and we're going to dive into that in this presentation. And we did that to understand the internal and external factors that are impacting supportive housing for women in Douglas County. And then we developed the theory of change that we're also going to talk about more today. And that creates that base of understanding the mission and the base for transformation that we are seeking. And then we defined our network model, and that's what we're going to talk more about today. And ultimately, commissioners, that's where we really want to get your feedback and whether or not you think we're on the right track with this, what we're going to share with you all. Oops, okay. So we're going to dive into the SWOT analysis, and I'm going to start us off with our strengths. Again, I'm not going to go through these word for word, but I think these strength, you all are very aware of the strengths in our community that as it relates to this work. Probably the biggest one is the dedicated funding that we have in the behavioral health sales tax and the existing partnership that we have with organizations like Cardinal Housing Network, DECA. Many of us got to celebrate the huge milestone that DECA had this past week, opening their supportive housing project, transitional housing project at the First Step campus that we've been working on for so long. And then we also have these strong institutional partnerships, again, reflected around this table. And we have these partnerships with organizations in the community that are a part of this work. So our strengths, those are things that, are a strong foundation for this work. The weaknesses, I'm going to hand those off to Carrie Nice to tackle.
Okay, is that close enough? So first off, thank you guys for allowing us to be here today and share this information that we've been working on. I'm going to talk about the weaknesses that we've identified kind of as a group through our SWOT analysis. From a reentry lens, though, I want to highlight housing from a capacity and choice perspective. So capacity is twofold, not only the lack of space and units for women in our community, but also the lack of supportive services available to get them through the process of rebuilding their lives. For reentry, our primary referral source for women releasing from custody is sober living. Those homes are often full, or they have several women interviewing for one spot. So imagine being in jail and making the decision for yourself that you're ready to explore sobriety, make some major changes in your life, only to be told that there's nowhere in the community for you to go and release to that is safe and sober. This can force women back into toxic living environments, maybe where sobriety isn't supported, possibly into homelessness or giving up altogether. With reentry, if we aren't able to release somebody into a sober space or a safe place, we often lose track of them upon release. Supportive services in housing individuals is imperative. This is more than case management alone. It comes through long-term wraparound services. So no wrong door when someone is asking for help. Reentry has been working with the Cardinal House over the past year. We've been providing case management for those entering into the home. Of the little bit of data that we have thus far, we are averaging one contact a day per individual living there. So if they live there 45 days, we touch them 45 times. That's obviously just an average, and we don't see them on the weekends or evenings. So sometimes it's more than that. Similar to capacity is choice. So in a perfect system, anyone being offered housing options would have some form of choice in the matter. In our community, for women or women with children, they generally have to agree to go wherever we can just find a place for them. That's not always what best suits their situation. It might not be what they would choose for themselves or their families. So working on this project is essential to creating a system that supports women in thriving versus just surviving.
Thank you, Carrie. I think next on our list, when we go to, we're going to go to opportunities, and that is Hannah Bolton.
Okay. So the opportunities that we identified in our work session was that we've got growing community and political momentum to address housing inequities. I think we're seeing a lot more opportunities pop up that are just folks that are intrigued with the conversation. And that is an expansion, I think, a lot of times of FlexPool that you guys heard about last week. Opportunity to build upon Cardinal's model to create collaborative care and a network with defined case management. Potential for building coalitions with businesses and churches for support. We've made some really wonderful progress on that as well. Engaging KU practicum students to extend clinical services, utilizing church land and faith-based networks for housing development, extending services to underserved areas like Eudora, Lecompton, or Baldwin, where currently there's no Oxford homes available to those communities. Exploring new funding and existing donors through Amethyst Place Partnership, developing a well-rounded board of directors, utilizing reentry simulation to build empathy with community members. And I think the thing that we're really excited about is the opportunity to standardize our data collection and sharing across agencies to document impact. One of the things that we'd struggled with too with referrals is that we're not all collecting the same information from our intakes with each organization. And so making a confident referral is oftentimes difficult when we don't have that standardized option to have folks submit their information.
And then threats, Zach's going to take us into that.
So as you can see up top right, the first point is limited institutional donors and competition for scarce resources among nonprofits. Probably the biggest kind of threat to something like this existing. We are lucky to live in Douglas County where places like Cardinal House, Willow, Family Promise places exist and we can work alongside. But that also means that oftentimes we are competing for, if not some of the same grants, all the exact same grants. VAWA, VOCA, like we all know these grants. So one of the biggest threats is just the access to money to funding. And for us specifically at the Care Center, the expectation that we might provide therapy for folks that are going through this transitional housing or support groups or restorative programming. If we don't have the funding to have the therapists, to have the hours to do that, it does not exist. We have 2 full-time therapists that are already back to full client lists. We already have a waiting list again. So if we can't be there to support with more positions or more funding, we literally don't get those needs met. And that's across the board, right? For all of these services. If we don't have the needs, if we're competing with each other, not only do they not get met, but that pulls resources from some other entity that already exists in the county. Slow city planning and permitting processes. I know that you are familiar with this, but you can just see how long it takes for these new places, these new houses, the zoning permits, everything to get up and running. Public stigma and discrimination and NIMBYism, right? One of the biggest barriers to something like this existing is discrimination is stigma, right? That these women, these children, these folks that have been facing addiction, they're defined by that as opposed to the need for housing or the support systems that they need access to. So that in general, right, we know is a really big threat. Funding gaps from a federal level, right? If we can support something on a county level or a local level, there is not that reliance upon federal grants, federal needs that are always being cut right now. We see higher disparities among the indigenous populations, and we were able to pull some statistics from the Lawrence Community Shelter, where just as of May, so just this last month, almost 10% of new guests were Native American or indigenous folks. And that doesn't count for multiracial, which can go up to 21%. And then as of 2 months ago, the entire population of the community shelter was almost 12%. But the indigenous population in Lawrence is just under 2%, right? So there is a way higher representation of Native and indigenous women in these shelters. So something to be very aware of as we're talking about the threats to something like this. And then lastly, there's no family court here, right? We know that there are many studies that show just the impact that family unification and support for an entire family unit has. And without no family court, that's another threat to something like this.
Thanks, Zach. Okay, we're going to dig into our theory of change, and no one better than to walk us through this is Sarah, who helped us develop this. So I'll hand it off to Sarah.
So just speaking a little bit more about our focal population, we're using the term recovery very broadly. So not only from substance use, but really all those different intersecting issues that women in recovery and their children face. So intimate partner violence, human trafficking, houselessness, untreated mental health, returning from incarceration. We're looking at recovery from all those factors, not just substance use alone. Although in order to be part of the network and live within Cardinal, participants do have to agree to live in a substance-free environment just for the safety of the community. The other thing we're looking at is a 2-gen model. So like Zach spoke about with Family Treatment Court, reunification is such a big incentive for women in early recovery. They want to reunify with their children. And so if we are providing that support for both generations, we believe that this will be a much more effective model versus just focusing only on women themselves and not the whole family. And lastly, we're kind of looking at an idea of healing in community. So as opposed to individual healing, we're building this community of women with a lot of shared experiences, a lot of similar goals, a lot of similar challenges. And that's something we see at Amethyst Place that is very effective, is creating this healing community of women who can lean on each other. So not just going to staff from all the network providers for support, but they're actually giving that support to each other. And so it's kind of extending that care. So that's sort of our focal population. We won't go into context and need because I think we covered that pretty well just now.
Thanks, Sarah. Okay, we're going to look at some of our core program activities. I'm handed off to Venetia.
We're talking about core program activities, and we're focusing and framing of like the outcomes more like so supportive housing is one of those holistic approaches we're talking about, where if women and children are able to be autonomous, this is a more of that approach of how that would look. And so we're hoping that this environment, this program creates trauma-informed substance-free housing. So they would still be in the space that they chose. They would be able to have the funding support if there was some increment of anything happening within the household. And there would be a team of people to support them that goes into that stabilization piece that you see. And so the case management, we already have a similar program that we're trying to pilot right now. And so that's good to have some of that information where case management, walking alongside families in sober living housing, where you're seeing that they can be comfortable in the household, share their individual stories, and have somebody to walk alongside them as they navigate their lives. And we're just kind of being part of it. And most of, the biggest steps from free entry on is getting documents. Like, so maybe like the first 30 days is trying to like put in applications for different things. And we're trying to work on that to make sure that those things get together. You heard Zach talk about that therapeutic support. Having those support groups, maybe even on site, would be really nice, where they can have a space maybe once a week where they can go to in those particular areas and talk, share maybe as a group with other people with lived experiences to kind of learn and grow as well. And then that kind of deals more into that recovery support piece where you have a designated coaches and support team wrapped around them fully. So when you're thinking about, when you're saying, well, how does those holistic approaches and pieces work together? You can think about them in those 4 boxes and how they navigate life, just like how we would navigate life. It's just, we're kind of breaking them up into different pieces so that you can see how that would be presented to them.
Great, thank you. And then I'm going to hand it off to Kim Fries from DECA, who DECA was, when we first started meeting with this group, we did not have DECA initially at the table. And the thinking around that was we really were focused on setting up, stabilizing Cardinal Housing Network to get set up and going and connected. And I mean, if just from my perspective, we're very familiar with DECA at Douglas County. They've been a trusted partner, and we knew that at some point in this project, we would be ready to plug them into this work, and that time has come. And no one better to talk about what this theory of change can look like in terms of the outcomes, the short term and the long term, than Kim Fries. So I'll hand it off to Kim.
Thank you. So, yeah, just thinking in terms of outcomes, we do tend to kind of think about this stabilization short-term stage of, are people safe? Are they, part of a community that allows them to have kind of psychological safety, as well as, safe in a legal sense? We're talking about, families that are looking at often reunification, like has been spoken about. So those shorter term outcomes are getting enrolled with benefits, getting stabilized, kind of making sure you have the pieces in place to get healthcare services. A lot of what DECA does is treatment and recovery services. So ensuring that you have a place for that. Stabilizing recovery from substance use is a long-term process. So we're just scraping the surface at 6 to 12 months. moving into those midterm outcomes, a year and beyond of recovery, you start to kind of connect more and be able to look at sustaining those things that you've just started in early recovery. How do I sustain a safe environment for myself and my family? Which has to do, of course, with employment and housing and, healthcare. Longer term outcomes, 18 months beyond, we're really kind of feeling agency and connection. And you know what I really think about when I think about outcomes for people that are looking to be connected is that, recovery isn't just about abstinence. It is not just about stopping your substance use. It's about connection. And so, how do we keep and stay connected? When I first heard about this project, I immediately thought about kind of a recovery ecosystem is what you're building. And so, that ecosystem is like things that depend on each other kind of in a symbiotic way. And people in recovery need other people. You don't recover alone. And so this is really creating kind of that network and that ecosystem of which, DECA has been a part for a long time, I think, in the community. And so great to hear about kind of this new effort to really, I don't know, strengthen the recovery ecosystem in Douglas County. And just one last thing about this, as people recover, part of the recovery process is giving back into your community. And so you're giving back into that ecosystem. And then as you do that, it strengthens your recovery and it strengthens the system. So those kind of outcomes, like that is where real change happens. And it takes everybody kind of doing their part that they specialize in, which I think you have here at the table. So anyway, just a little bit about outcomes.
Thank you, Kim. All right, I'm going to round us out, and we're doing great on timing. So just in summary, the ultimate impact, community outcomes, we're looking for stronger cross-sector partnerships. The folks around the table are just one example of the partnerships that we already have. We're looking for increased and diversified funding, expanded housing capacity in the community for this priority population, improved provider collaboration around where there are gaps and opportunities to partner, and then strengthening the Douglas County workforce that is required to do this work, but also, how can we take the folks that are recovering through our partners and create meaningful job opportunities to, you heard about our peer workforce last week. The sequence of all of our conversations these past few weeks have really, I don't think we really thought it out, but it's worked really well. So the ultimate impact, women in Douglas County experience a coordinated continuum of specialized support leading to reductions in houselessness, recidivism, trauma, violence, and substance abuse. We improve the quality of life for women and families with increased family reunification and disruption of intergenerational cycles of instability. And we see a shift in public understanding toward the systems level solutions, accompanied by the stronger community support for the lasting policies and systems that enable lasting change. And when Kim said ecosystem, it's my favorite visual. It's the last slide. Oh my gosh, it's the best. So when we visualize what is the model, what does the network model look like? This is what it looks like. You have the agencies that are the organizations that are providing the supportive housing. So we've got DECA on there with those new transitional units. You've got Cardinal on here. You've got Family Promise. Family Promise isn't connected to that. What is coming online through Family Promise here soon is the 9th Street project that Family Promise is a component of, and we can list that on here at some point. But then you see the stabilization support, and that's one of the most critical components here. But you see Family Promise, reentry services, the work that reentry has been doing to support Cardinal Housing in the initial months has been incredible. But it's also not sustainable. You see Burt Nash on there for the stabilization, Heartland Community Health Center, providing all the physical health and behavioral health as well. And then you see those recovery supports that we've talked about. So whether that's Mirror Inc., Heartland RADAC, and then DECA, of course. And then you see at the bottom the therapeutic supports, which is where STA Care Center comes into play. And of course, you see Burt Nash again. And I think what this is the vision that we have for it, that no one organization owns this work, that it is a network. And Hannah just happened to add Cardinal Housing Network to the end of her, the title of her organization. So we're really leaning into that network because I think Hannah believes in that, but she needs that network of support. And as we've talked about today, the women that we're and the families that we're working to serve, they need that network of support as well. So with that, we want to open it up for discussions. I will stop my share screen.
Thank you, Jill. Thank you, everybody. That was a great presentation. You did really good on time. I'll back that up. Well planned, and good cadence. So, commissioners, questions top of mind for you?
I guess I'll start. I know DECA just opened 5 duplexes for housing. Can somebody here or Jill tell me how many total units of housing are available for women in Douglas County?
Total units, I don't have that. I can pull that up here in a minute, but I'll let Kim talk about, it's 10 units of housing, I believe,
Yep.
at the DECA campus. Hannah probably knows off the top of her head how many units she has open currently from Cardinal.
Yeah, we have all 3 apartments filled at 1128 Ohio. And then we've got it was originally 10. 9 is a much better number. If we're being honest, 8's a great number for next door. So those are for single individuals. And then there are only 5 Oxford homes in Douglas County. 2 of those are eligible for moms with kids to live in them. So 15 beds total. So between DECA and Cardinal, we've essentially doubled the amount of beds, if not tripled.
Right, and the DECA housing can hold up to about 20 folks in that space.
And then what is the overall need?
When we looked at, I think that's a great question, Commissioner Dorsey. I think like there's a variety of ways that we can look at that. And we can follow up with you about what we think when we put together the needs assessment with Corporation for Supportive Housing. We were looking at just the raw numbers of how many women were experiencing homelessness. So let me follow up and look at, just for example, like how many women are at a blush, how many women are currently on our coordinated entry list. That could be a starting point. But I don't know. I want to ask, put Carrie on the spot here, because when I think about one of our primary populations that we are referral partners, pipeline, so to speak, it's the women that cycle in and out of the Douglas County Correctional Facility that do not have, because they don't have a safe landing spot, they come back or other things happen to them. But Commissioner Reed, I know you also have a sense of what that need is as well.
Carrie, how many women get released from jail each month? Approximately.
That's a great question. I can talk generally about like the need that we have for women. Like I kind of shared in what I talked about was there really is no choice for women. So the first thing we look at is sober living. If Oxfords are all full, we will lean on, there's another program, now it's escaping me, Freedom Home. We do look to them, but honestly, their option is the shelter. We can get them 3 days at the shelter respite. And then they have to go into either the regular night by night program, or they can sometimes get into the 90-day program, and we work from there. The shelter isn't a great release option. It's a good support for our community, but we tend to lose people once they get past that 3-day respite where we know where they are, they feel safe, and we can go straight over there and see them. But when they have to leave at 7 a.m. and they can't come back till 7 p.m., we tend to lose them. And so that's why I had mentioned anything support. I mean, we try to get them somewhere supportive where they're safe, they're in a supportive, sober environment, and we can visit with them, make appointments with them, and keep moving along down that path. I don't have exact numbers, though. I
That's
apologize.
fine.
We can
Uh,
follow up with all that, though. Those are great questions. We should have come prepared with that. So,
And
yeah.
then the Family Promise, I don't think that's quite open, but well, I mean, the unit on 9th Street, looks like they're still working on that. Is your audience a different group than the jail or DECA?
Have some families that overlap with those same barriers. So for instance, in 2025, we served 269 families. Of those numbers, 175 were women-led households. Of that number in our shelter, we do have a shelter program. We can house up to 6 people at a time. That number probably was 30. So of those, that's how that breakdown looks like in our eyes. And that's without the project that Night Street is working on.
Yeah, so say someone comes out of jail and they have a substance abuse problem. I don't know if they're referred to DECA or Cardinal or you, but are you in charge of that referral? Okay.
Yeah, so like I said, normally sober living is the first step. We look to Family Promise, we look to Willow, we look to other places for kind of that second step. Like we get them stable, we get some things established, we meet with them regularly in the community, and then we start looking beyond that of kind of like what is the next step. Cardinal has been great. I don't want to compare them to AHH because they're not AHH. But they have been a great second option for our women. And it is a great feeling to explain what their option is. Cardinal is more structure. You're going to have more case management support. You're going to be seen a lot more. You have a house manager in the house. Or there's the Oxford House model, which is less structure. You know, you don't have a house manager. And just to let them choose what they feel is best for them at the time, that's a big deal. So we've had that. We've been working with Cardinal about a year on kind of doing referrals that way, and it's been great.
And I have a question for DECA. Is your clientele mostly they come in on their own to try and beat whatever issue they have?
Into treatment, like into a First Step, Lakeview, like a treatment environment. I would say, I don't know that they come in on their own. They are
Or a family member?
right. So they are, we often say people don't see the light and come to treatment. They feel the heat and come to treatment. So they get heat from different places, might be family, might be the legal system, might be, their job. And we hope that while they're there, they kind of develop that intrinsic motivation, which is that seeing the light, if you will. Does that answer the question? So we get referrals from all over, especially because we're one of those few women's and children's treatment programs, but it's a very high level of care. So pretty severe substance use being treated in our residential.
And back to Carrie. Sorry, I thought of something else. Are most of your people being released from jail have a comorbidity of either alcohol abuse or drug addiction? And are they in jail long enough to be partially on the way?
Yeah, so that, it depends. Just thinking about it, if not just because you go to jail doesn't mean that you want help or that you want to make a change. So the interesting thing about reentry is it's voluntary. Nobody has to work with us. The services are there. We talk to them. We meet with them. We have a booking follow-up screening where we have a screening tool to identify mental health and substance use. We partner with Mirror for a position in the jail that follows up every morning after bookings and approaches the people and says, hey, she has lived experience, so she can relate to them differently, and plants that seed of, if you're interested in any kind of resources, we're here. Sometimes it's not the first or fifth or 10th time that they engage with us, but sometimes they do and sometimes they don't. So did that answer?
Yeah, do you have a rough idea of what total percentage try and use your services?
Um,
Either the first time or the 10th time?
Yeah, no, I don't. We offer, so we have case management. We offer um, classes in the jail too. So some people just choose to engage with classes. So they come, we do recovery-based classes, we do COG-based classes. We have partners from the community that come in and do classes. So Care Center comes in, Willow comes in. So people engage in a lot of different ways. So whether they engage in case management or engage in other ways, I wish I had my computer and I could pull up some of those stats for you, but I don't have it with me today. Yeah.
And just looking at some of the homelessness data, it's about 250 to 300 women experiencing homelessness on an annual basis in Douglas County.
I got a question for you too. Why do you think the indigenous population has such a high percentage you were talking about?
Yeah, so I think I want to note one that is not a, it is a local issue, yes, and it is also a trend that is national, right? So you can look back to long roots of the way that Native folks have been treated, but also specifically Native and Indigenous women in our country, right? So access to resources, access to different types of federal funding and the resources that they have, how they're treated differently when they come into places, how, how a government organization might interact with a tribal organization and separation of services. There's a lot of things that can go into the reasons why that happens. And something I wanted to note too is that, and maybe this is like kind of the obvious, but like your question about how many people, it's bigger than just like who is lucky enough to like meet Carrie or to know people at this table, right? Jill spoke to the 200 to 300 folks that are in the shelter, but we also have people that, may not meet the normal definition of like what it means to be homeless if it's on somebody's couch who is experiencing, other things that you're talking about. It's a lot more than just like the people that are, going through the reentry program.
You think all those folks are from Douglas County, or do some come down from the reservations?
What folks are you talking about?
American Indians.
I think that it is local folks. I think that is folks that is traveling. I think the important part would be that there are services here for the people that need them, because people are moving and living at different locations. So if we have a place that they can seek services, that would be a benefit to them.
I'll let somebody else have the mic for a while.
I think I have a couple of thoughts to follow up on Commissioner Dorsey's questions and just the conversation so far. I think, one thing that I appreciate you pointing out a couple of times, Carrie, is that ideally in your position, in your role where folks are looking at leaving jail and trying to make important decisions about what their next steps are, that choices are a part of that. I really appreciate that and want to reemphasize that, and that we're having this conversation, and this conversation has been evolving over the years in our community because there is such a clear lack of choices and options. And so it has exacerbated the problem so that we have a disproportionate amount of women, female-led households that are experiencing homelessness and struggling to ever find housing stability. So I just want to highlight that, and choice is really important. And I think, to your questions, Commissioner Dorsey, kind of about the different referral pathways, or, who gets referred where and when or for what reason. I think oftentimes, I don't want to put words into your mouth, Carrie, but I think probably for your program and for many other programs where referrals might be coming for housing, it's referring to all of the above. The answer isn't A, B, or C. It's all of the above. And sometimes, hopefully if housing is available in a few of those options, then choosing a different level or acuity of housing options and a different level or acuity or intensity of supportive services that might be available with that is part of the solution that I'm excited that we're working towards and hope that we can really help to shore up, because I mean, choices are that's empowering. That it's not people being told what to do and what they need to do in order to stay out of jail or stay out of legal trouble or get their kids back or, you know, ... But it really is about empowering folks with options, so that, and that they may use all of the above, right? That they may leave jail and come to Cardinal Housing Network for a small spell, or they might go to high acuity, more intensive treatment because they're feeling the heat at DECA, and they might not move into housing from DECA. They might move from DECA to Family Promise for a period of time, who helps stabilize them and into the community, or to Cardinal. And so that the opportunity for options is something I'm really excited about, and just want to really appreciate that this cohort that we're talking to and all the other partners that have been mentioned and that I know will be pulled into the work over time, that like that ecosystem building is really important to be able to give choices. And it also means that if the first choice is goes off the rails for whatever reason, isn't a good fit, then there are other options, that we're not just straight back to street homelessness or incarceration as the only outcome of it not working out at Family Promise or DECA or Cardinal First. And that's a key factor to me in building this in. Another thought I had is just to follow up on the questions of like numbers and trying to get a handle on that. I think we look at numbers and data from so many different levels now, and that's ever increasing in Douglas County. And sometimes that can make it convoluted to pinpoint what number we're trying to get at. But I would venture to guess that that question that you asked Commissioner Dorsey about just the need currently versus the need that we reread about in our 2022 needs assessment, we can look at the total number of folks experiencing homelessness that we know from at least the PIT count year over year. But beyond that, our coordinated entry system and HMIS usage has strengthened significantly in recent years. So I presume that that is probably the best, and I'm looking over to Jill to see if she wants to correct me or affirm my line of thinking, but that the coordinated entry system is probably the best place to be able to determine, quarter over quarter, year over year, what that need is, and if we're making progress on filling the gaps and meeting the need, or if we're seeing the needs growing despite our efforts to double the amount of supportive housing units. So I think that is something that, especially as this network is solidifying and things start, more opportunities are available, that we are figuring out how to look at that data point and maybe some other data points and try and get just the really zoomed out big picture numbers, in addition to all the other sort of data outcomes that each individual organization will be, thinking about and tracking for and whatnot. There was no question in there. That was all comments. Unless, Jill, you want to affirm that.
No, I would affirm that, but I think the other place that we would look for, because this work is grounded in a place for everyone work and trying to better understand rates of homelessness, prevent homelessness. I also think we'll see, ideally, we see the inflows into homelessness go down. When we look at our dashboard that we have, you have outflows and you have the inflows. You want to see those outflows go up and you want to see those inflows go down. So that's the curve that we'll be seeing. And then if it's, I think one other reason we looked at Amethyst Place as a model, when we talk about referral partner, what does a referral network look like? Amethyst Place has a great, the referral network is really grounded in some really important institutional partners. And one of those that, we could dig in a little bit more if you ever want to learn more about, and we're going to learn about it as a group, is the Family Court, the Family Treatment Court for Jackson County. And the institutional partners that Amethyst Place is already tagged in to work with. That's why we're looking at that model for us.
Carrie, for the women that leave the jail, documentation, vital documentation, do they have all of their documentation in hand and in place before they actually exit the jail?
Yeah, so it depends. Um, we can do birth certificate and social while they're in custody, which is essential to getting your ID. So we can't do ID in custody, but we will go with them upon release to take those documents we can get while they're in custody to get that ID. We can help with paying for that ID. And again, we can meet them there, or if they're working with another agency, we can send it for them. So it just depends. There's always some barriers to that. If they were born in another state, the backlog is real and sometimes it takes months and months. You can only get 10 Social Security cards in your lifetime, which seems like a lot, but if you're cycling in and out of the jail and applying for one every time, then you meet that 10 really fast. Once you're there, if you're working with an agency, whether it be reentry, whether it be Family Promise, somebody can advocate on your behalf to get another one. But it takes time, it takes engagement with the client and things of that. But yes, they can be ready for an ID upon release.
Okay, and then upon release, are you all able then to support them after release as well? And or some of the other organizations then to continue to follow them? And then do you have a cutoff at all as far as how long you can follow them so that you can support them in finalizing that ID?
Yeah, so there is no cookie cutter reentry pathway per se. So everybody's situation is a little bit different. I'll use an example of if somebody were to interview with AHH and go to AHH, we kind of take a secondary on that. We will still meet with the individual, but AHH is the primary case management because we don't want to duplicate services. We're still there. We'll have conversations with them to support them. Let's say AHH isn't a good fit. Then they have someone they can talk to about that so we can explore other options. We have some housing vouchers, and we have an agreement with the Housing Authority that if we get somebody into housing on a reentry voucher, we keep them for 24 months. We provide case management services for them that entire time. And if they are successful in that, then they can transition over to a general voucher. So that's our more long-term, and everybody's needs are different. Some people have family support out there where they just need us for barrier reduction stuff. Maybe they need their ID. Maybe they're having trouble getting to their probation appointment or keeping track of their court dates or something like that. Like we can assist with that. So that's not a great answer, but there is no timeline per se. They can be with us if they have a housing voucher for a long time, or they can be with us as little as 30 days if that's all they want, or all that they need.
Okay, I just wanted to check in on that because I think I saw on here, Hannah, that within 30 days they start paying rent. Is that what I saw on here? Am I correct?
That's our current structure. Again, we're definitely modeled very differently than AHH with very similar goals. But AHH has a fully subsidized program. So when folks come in, they can, for however length of time, can stay, build work history. They have an 80-20 savings model. So any dollar that comes in the door from their employment, they're saving 80% of it and spending 20. And we don't have currently the infrastructure, the financial capacity to be able to provide that. So reentry sponsors 4 beds for each month that allows us that opportunity for them to not work. We've also been leveraging funds from Heartland RADAC. NEAR just recently ran out of some barrier reduction funds from a KFA fund, but that had been a huge support for folks. I'll note too, like when we're talking about this continuum of care, a lot of the folks that were getting into Cardinal have been at the jail, have committed to, gotten an assessment there, committed to go to treatment, whether that be at First Step or MIR, come back. Once they enroll in Cardinal, they are immediately enrolled in IOP. And so between the two partners, we've got a pretty nice flow of continuum of care. But the greatest barrier is always going to be the fact that they are going to have to start paying rent right away. It takes a lot longer than you think it does to be able to find something that works with our kind of rigid structure as well. We don't allow folks to work overnight. A lot of the factory jobs in Douglas County are those types of positions. And so our structure kind of puts them in a position where, especially if they're doing IOP 9 hours a week, where, you know, we've got to be flexible. And so that 30 days is the bare minimum. I would love to see it a minimum of 90. I'd love to see it honestly to a place where we could get these women as they're stabilizing to be able to save that same proportion as the men are able to, that 80-20. I think that would be highly transformative for their entire breadth of housing experience.
Can
And
you
then
explain what
childcare?
IOP
Oh,
is?
I'm
I'm sorry, I
sorry.
just
Oh,
wanted
yeah.
to flush out what IOP is.
Intensive outpatient treatment. So both DECA and MIRROR provide that here in town. It typically starts out with 9 hours a week, so 3 3-hour sessions. Some of it, if it's coupled with drug court or other court systems, there's therapy included in that. I know both DECA and MIRROR have peer supports as well. So some supplemental stuff is able to be provided through our treatment partners. Please,
I
please.
just wanted to add on to the subsidized housing. So for comparison, at Amethyst Place, they don't pay rent for the first 6 months. So we have state of Missouri vouchers that cover that. And what that does is it allows them to establish that psychological and physical safety that they've lacked possibly for decades in their life. They're able to get to therapy. They're able to get on medications, get their physical health needs met. All those things that are very challenging to manage if you're so stressed about working and finding a job, often in industries that are not conducive to early recovery. A lot of women, when they come, they're working overnight stuff. They're working in hotels, they're working in service industry, bartending, things that are counterproductive to their life goals. And so by subsidizing that early housing, it allows them to really kind of do an entire life reset.
And then childcare for women who do have younger kids or would need some form of childcare?
Becca can speak to that. We currently don't offer that at Cardinal, but it is a huge need, huge need.
It is transformative again for moms that, you know, want to go kind of establish their lives in ways to know that their kids are taken care of. So the First Step model has a certified childcare center on site. So it allows moms to, you know, not have to choose between, do I want to get sober or do I want to care for my kids? They will not leave kids behind, you know, given that kind of a choice. So it's a beautiful model. And our childcare also offers, it's a community childcare. So they're taking our kids and they're taking kids from the community. Just because we have the space and the ability and the community needs, you know, affordable childcare. So and then our transitional housing, women in that location will be able to use that childcare. It's just right across the driveway. Really, really helpful, incredible model for women.
And I just have one more question under opportunities. Under opportunities, it was listed for partnerships, looking at for partnerships for housing around land. And you did mention high need population around Indigenous populations. So I was just kind of curious if there have been any conversations around partnering with our Indigenous population and seeing if there are any opportunities with native land. So if those conversations had been had.
I've casually had those conversations with a couple folks that I know. The main hat that I know them as is their faculty at Haskell, but I know that they're also really involved in their tribes, and that's something that I think that, you know, just in a casual conversation I've had on that same topic, there's a lot of interest. So I think that that's something that we can continue to pursue.
Yeah, because I think maybe that could be also just a really good opportunity to support them along, you know, a whole host of different whether it be behavioral health or social determinants of health, and just see what sort of opportunities might exist. Could potentially be grants as well, but maybe that's an opportunity.
I wanted to add just one more thing onto Hannah's about paying the rent after 30 days or however long reentry can support them. What we've seen in the last year is ladies doing very well. getting to the point where they're ready to take the next step, but they have no money. So there's nothing, they haven't been able to save. Whereas on that 80-20 split, that sets them up to be able to enter into their own unit or something of that nature. So we've seen that already. We've had a lot of conversations on how to address that, but then yeah, kind of what that looks like. But we've already kind of seen that trend coming where we've had ladies ready, and just the inability for them to continue good standing with Cardinal and move into the community to their own unit.
I have some questions for Sarah. I think our first introduction to Amethyst was in a municipalities fight addiction funding request. And I think from the commission, there was some questions about where did this come from? And can you give us just a little bit of Amethyst's history? And I'm especially interested in, when I looked at your annual report, it looks like you're a fairly large organization. Maybe you just have a lot of staff, but like how you see what you've experienced in Amethyst in Kansas City and how that might transfer to Douglas County, where we have quite a number of partners with different, models. And, we have Lawrence Douglas County Housing Authority and DAGA. And I'm just interested in what you see after working with the group for a little bit.
Yeah, that's a good question. So what's interesting to me is Amethyst Place was founded by nearly the same model as what this group is doing right now, which I think is really cool. So they started working back in the 80s. There was a task force put together that was looking at the needs of single moms with substance use disorder and how going to inpatient treatment and getting out without safe housing was very ineffective. They were not maintaining their recovery, and their kids were remaining separated in foster care. And so a group came together of, many of the folks who are at the table equivalent in Kansas City, and said, we've got to do something about housing. That's kind of that central unifying piece for all these systems that can only do so much. But if you don't have a safe home at the end of the day, you can't really move forward in life. And so started out as 6 units of housing, kind of, similar scale to what we're talking about here. Very little staff. I would say our staff only really grew that much in the past couple of years. So it leaned heavily on partnerships. So it's exactly what we're talking about here. We have a program council of 19 referral partners, but we work together to coordinate care, just like what this group is doing. And so we're not trying to be everything to everyone, but we're pulling in expertise. So family courts coming in and helping with reunification. We've got treatment providers who are helping support the women if they're in outpatient treatment still. We've got an early childhood provider. We have just a reentry program. So it's kind of cool to me how similar these two are. And it's evolved, of course, where we've brought more things in-house just as funding has become available, but we still partner very heavily. So we've seen it work. Those providers all come on site typically to provide services, which increases access. So having it kind of in this campus model is really nice because providers come on site. There's no transportation or childcare barriers. It really increases their ability to engage in services. So.
I was going to say also, one of the things, the Amethyst Place has a really compelling approach, that this approach has also attracted over those 25-ish years, a lot of private donors, corporate donors. And that's when you saw in the Opportunities Board of Directors, how do we look at what has been successful in the development of the Board of Directors at Amethyst Place and how they engage the community. I live in Johnson County, and I've followed and been a funder of Amethyst Place for a long time because I've seen their impact. How do we raise that profile and have the Board of Directors, whether it's in Cardinal? I mean, I saw that on display full on at DECA last week. We've got the ingredients here, but how do we share that knowledge? And it's already kind of benefited us because they have in their
Our biggest major donor, I mentioned this project, and she sent an end of year gift to Cardinal. So I feel like more is going to come that way as this partnership builds. And I also shared, we've done some training on what our funding model looks like so that I can explain how we've diversified revenue and brainstorm ideas. So we had a meeting with Andy Brown from KDADS. We are starting to brainstorm what are Kansas equivalents of things that are helpful for Amethyst Place in Missouri. So really trying to get creative, because especially in the climate right now, you can't rely solely on one or two things. You've got to really diversify and get creative and engage business community. For instance, we have companies that will sponsor apartments and pay for all the furnishings to set up an apartment. There's a lot of creative ways that you can get things done with your community.
And is there anything that you're seeing? I mean, clearly we need more. The need is high. We've known that for a number of years. And the resource demand is going to be high as well. What things can we take advantage of based on your experience that won't take us 46 years? You said you started in
26.
26.
Yeah, the planning was, the planning.
Yeah,
was-
it started in 80. Like,
Yeah,
I don't,
right.
I mean, I don't want to wait 46 years to address this issue. What do you see here that you think will help accelerate our work to make progress on this really big challenge?
I mean, I think you've done the hard work of getting the right partners at the table to come together and realize that Cardinal alone can't do this, SEC alone. It's going to take this coalition approach. And I think you just have to build day by day, start small and keep building. When you mentioned the vouchers, I instantly thought, I wonder if there's a landlord here who'd like to do a master lease of a building that you could dedicate with the vouchers. That's how we have expanded, was starting with a master lease versus needing the funds to purchase a building. And, I just wonder if that might be an option, and just slowly build and build. I mean, I don't think there's one special answer, but just being creative, quite honestly, and pooling your resources together, which I think you're already doing. And then of course, like I've shared all of our materials, all of our clinical documents, our resident handbook, all these things that have taken 26 years. It's like, I'm hoping that the group can not copy paste, but practically to save some of the headache of developing things. Our clinical team has met several times with the group and are happy to continue providing advice and consultation, especially in the way of peer support and how that could play a really important role in staffing the model. That's something we lean into heavily. And I think, like you were talking about, giving back to your ecosystem is really important to think about. And it's a workforce development thing as well. So looking at, maybe former participants of Cardinal, and could they come back in and do peer support? So
I'll just note too that I think we do have a bit of leverage if we were to collectively submit grant opportunities for SAMHSA funds, federal, state funding, and finding ways that collaboratively we can be potentially a lot more attractive to some of those federal dollars, whether it be through making the ask through Douglas County or through a more established organization like DECA or something like that. So
we were really encouraged by the conversation we had with Andy Brown recently. And that was, everything from creative solutions around what would it look like to have a DCO, a direct care organization agreement with Bert Nash, because many of these other folks that are served by our partner organizations around the table are also Bert Nash clients. Can Cardinal bill or our STA, if they're providing the services, bill Bert Nash and Bert Nash get reimbursed? Andy said, I think you should look into that. But then also, looking at, Andy was really encouraging of those SAMHSA grant opportunities. He sees a lot of compelling opportunities. So I think Brooke's here. When we look at like the county's role in this work could be holding grants, managing those grants, but we have because we already work with all these partners around the table, we already fund them. We have a model to be able to administer possibly those big grants and to distribute them effectively. And we're really, this commission has leaned into braided funding approaches. And that's what we're really leaning into with this opportunity. And we're trying to just make sure that we're housing vouchers. That's, we learned, and we already have a little bit of that. We're using flex vouchers in some of the Cardinal housing units because that just makes sense. I think we'll do that in the projects that 9th Street will be opening up soon. We might be doing that at the DECA units. those are all on the table with what we have available to us, but we know that we've got to continue to interrogate those additional funding sources that are available.
It's like you took the words right out of my mouth, and I wanted to say that I am really hopeful about the foundation building that's happening means that those collective, collaborative grant funding opportunities are something that is possible to seek, because I mean, we've heard the story a million times over from some partners around this table, from other partners in the community, that depending on size and scalability of their organization and capacity for administering any kind of grant, let alone complicated federal grants in particular, or some of the state grants, is a significant lift and just something to sort of never touch because it's too hard. And so I do think that, like, that's one of the, you know, the county plays a very good role in helping convene critical conversations. And I believe that tangibly, like, we have the infrastructure to be able to support more administration of complex grants sometimes. And they know there's a trade-off there, and it's a different direction in some ways than some county or city governments, wish to go. But I think that our flex housing pool is a great example of, like, us taking on more opportunities to apply the skills and the infrastructure that we have within our organization that have a bigger collective impact. So I am very hopeful about that opportunity, and that having a multidisciplinary model and modality is going to be significantly attractive to some of those grant programs. So I'm looking forward to that. And then another thing I wanted to say was, I think that, like, I'm so proud of and sometimes flabbergasted by the progress that we have already made. I mean, I just want to put a point on, like, from the 2022 needs assessment to now, we have significantly more units than we did in less than 5 years' time. And that is not nothing. And so I feel like we've got some really good momentum, and that tangible, that being able to go walk through the units at DECA last week, being able to do the, see Cardinal Housing network houses come online, very much excited to be able to walk through the units at, 9th and Tennessee soon. And that's hope building. And, it's not a full centralized campus in our community. It's scattered site, but the fact that all of the organizations are working together and figuring out what pieces of the puzzle they bring to the table, and know that there are those options. I'm impressed with us so far, and I want to not miss the opportunity to say that, and that we've got some good momentum to keep building on. And I'm super grateful to be able to have a model just down the road to look at, and it's really affirming to hear you tell the story about how this is a similar start, that it was coalition building, a little bit of grassroots organizing initially, and everybody sort of scratching their head saying, like, how do we figure this out? Because we all just keep hitting the same barriers and not knowing how to get around them. But collectively, we figure that out a lot better. So I'm grateful for the opportunity to be able to learn from that and apply it in a scalable way. And I think, another, like, significant opportunity we have has been highlighted by a few of you, is to really think through this piece of the workforce issue. We've talked about workforce issues just last week again, but over the years here, and in a variety of ways, but I'd say very much specific to care work, mental health providers, healthcare providers, peer support, case management, advocacy. All of those things are they are hard to get people into those fields. It's hard to keep people in those fields, and with an increasing capacity of actual units and ability for people to have safe housing over their head, we obviously need to increase the services around that. So I'm very much interested in how the conversation around workforce evolves and how you all are sort of integrating that into your different organizations and the way that you serve folks. Like, how is it possible to provide opportunities to to use that lived experience and turn it into a career that matters. Because I mean, that's why I do the work that I do, because I met other people who had lived experience and turned that experience into positive impact for other people. And so it's a powerful thing in recovery, especially. So I'm really interested in that thread being pulled on. And then the other thing I want to leave you all with is, I don't really have a question about this, but I would just invite more detail and more specifics about what each of your organizations have sort of experienced, and then collectively what you're thinking about around this idea of family treatment court, around this idea of more significant partnership or involvement or changes with local court and legal systems. I obviously have much history with and many opinions about and thoughts about it. And frankly, family treatment court means 1,000 different things in 1,000 different communities and jurisdictions. So I'm interested in unpacking that a little bit more and understanding from your individual organizations and then collectively how you're seeing those legal issues pop up. We talked about some of them here, right? Where obviously anybody coming out of the jail, we know that there's a criminal case going on. But what else is it? If Child Protective Services and DCF are involved and there's foster care, that's one thing. But then there's other things that don't involve maybe those two intensive systems, but it is more in just the family civil law court. And what are the different legal issues that you're seeing these families face, and what specific barriers are you clocking for that have been insurmountable? I'm just interested in unpacking that more. So I would invite more discussion about that and some feedback to us about how do we think through engaging with our judicial system, both on a local level, but also a statewide level, because I think some of these conversations are happening at a statewide level about what does family treatment court mean? What could it look like? I think that's a very long runway conversation on the state level, but yeah, I would just like to understand that more as you all keep talking through it.
And I would just encourage us as we're thinking about grants to maybe think a little bit more along collective impact model and maybe to lean in more to some of our partners, whether it be Lawrence Douglas County Health Department, DECA, Lawrence Douglas County Housing Authority, and the fact that they have applied for a lot of grants. They've managed a lot of grants. They've been doing this for many years. They have a lot of rigor and standards of excellence that they have already applied. They're used to reporting on these grants. And so I think they would be fantastic partners when it comes to managing these grants for our partners. And then the county can maybe be a partner in that process versus being the individual, the entity that is applying for the grants and then disseminating the grants on behalf of the partners versus I think it should be our partners that are partnering and being the applicant and then really the backbone organization partnering with all of our partners. I think that would be more of a collective impact model to really move the needle and have the impact. And then when we think about the community health improvement plan, we have our health department that really guides that. And so that would fit really well into that particular model. And then we have all of our metrics and our objectives that fit really well into that. And so that would ladder up really well when we think about having a robust metric system to really measure the work that we're doing, especially for a place for everyone. So I think that would be a good opportunity if that's something that we'd like to look at.
Thanks, commissioners. You're going to hear about some of the partners and what we're doing during the budget process. So this is a great primer, and we are really grateful for all the great conversation and the time.
Commissioners, any closing questions or comments? All right. Well, thank you all for your work so far. Thanks for spending the afternoon with us, and we will be recessed until 5:30.